Hi, Alice.
Good morning, everybody. Thank you for joining us. We will give it just a minute so everybody can join the meeting, and then we will jump in and get started. All right, good morning and happy new year. My name is Amara Baharamiarif, and I'm a branch chief in managed care quality and monitoring supporting the MOU effort. Today, we are going to talk a little bit more about the targeted case management MOU template. We are excited to go over this template and get some feedback from all of you. I do want to notate that this webinar is being recorded and will be posted online, so I wanted to make you all aware. We will give you an opportunity to ask questions at the end of this presentation. You can do that by raising your hand and or dropping your questions in the chat. So thank you so much. We will jump in and get started. My apologies, my computer is a little delayed, so I apologize for the flipping between the screens. But for today's objectives, we are going to review the targeted case management MOU template. We're going to review the MOU execution timelines and then open it up for valuable feedback from all of you. So we wanted to just kind of start with a high-level overview of the goals of the memorandums of understanding. Our new 2024 Medi-Cal managed care contract requires our managed care plans to enter into MOUs with counties and third parties to ensure provision of the whole system person-centered care approach. So some of the goals of the MOU was really to establish minimum requirements around some of the key contract provisions, which we'll cover in a little bit more detail later on in this webinar. Really clarify roles and responsibilities for coordination of delivery of care and services for all members, including services that may be carved out of the managed care plan. It establishes formal processes for how the managed care plans and other parties will collaborate and coordinate on population health programs, including referring and linking members to community supports. It also establishes data sharing pathways between the managed care plans and other parties to really support that care coordination and enable robust monitoring across the parties. It also provides overall oversight and accountability between the parties and provides transparency regarding roles and responsibilities between the parties. So as you can see, the goals of the Memorandum of Understanding are very lofty, and we're really excited about improving members' access to care with these MOUs. Right, so we wanted to provide kind of high-level overview of some of our valuable MOU resources that we've created. DHCS has launched a DHCS MOU webpage, which is linked in this deck that was attached to the invite. We can also drop that link in chat for everybody to access and access this. This website contains all of the MOU templates that we've issued thus far. We have issued about 8 other MOU templates. It also includes the all plan letter, which provides guidance to our managed care plans, but also provides a bunch of details related to the MOU effort. And then it contains, thank you, Sophie, also the base MOU template, which really sets the foundation for the MOUs. We'll talk about that a little bit more in future slides. In addition, we've included an MOU FAQ, which includes a bunch of valuable resources, about 16 pages, that provides questions and answers related to the MOU. So I highly encourage, if you have questions, reference that document. If you have additional questions outside of these resources, there also is an inbox that is linked on that website. You can submit questions directly to us. We are happy to assist in providing technical assistance to execute these MOUs. Other valuable updates will be posted on the website related to webinars. We do anticipate that we will host another webinar after we've released the final TCM MOU to provide an overview of the changes that were made based on the stakeholder comment period, which closes today. So we wanted to just kind of give you an overview of how the TCM MOU fits into the other policy documents that the department has released related to this larger MOU effort. So as I kind of referenced earlier, we did release an all plan letter, which provides guidance to our managed care plans and really sets forward the expectations surrounding the MOU. It explains the intent and purpose of some of the provisions of the MOUs. And it also contains other monitoring requirements that we've set forward on our managed care plans. We also issued what we're referring to as a base MOU template, which really sets forward the minimum provisions that are required in all of the memorandum of understanding. Some of those provisions include clarifying roles and responsibilities between the managed care plans and other parties, establishing rules for dispute resolution. And then we've also included some optional provisions that you'll see contained throughout the MOU templates, which are notated in brackets and italics. And those we put forward as recommended provisions to include, but really encouraging there to be discussion at the local level to see if it makes sense to include those provisions or not. So please, we encourage collaboration and coordination on those optional provisions. And then we have what we refer to as the bespoke MOU templates, which in this circumstance is really specific to the targeted case management MOU. And it contains specific provisions that are related to a specific program or programs, kind of depending on the MOU type, which really provides some additional clarification. And we're going to talk about the TCM bespoke MOU template in more detail later on in the presentation. Right. So the purpose of the TCM MOU is really to improve care coordination between the MCPs and the LGA TCM programs through the following channels, really opening up channels of communication and improving communication between the MCPs and the TCM programs to coordinate care for individuals receiving services from both parties, and really to address non-duplication of services and referrals to really support that whole person care approach. So we really think that this is a really great opportunity for these parties to collaborate and ensure members are receiving services that they need in different delivery systems. Also really focus on enhancing each other's parties' understanding of the other respective services related to eligibility criteria, referral processes, and operations to really support the member. So next, we want to just kind of talk about the base MOU templates, which are contained in the targets that are really contained in each of the MOU templates that we've issued thus far. So really kind of serving as the foundation of how we developed these MOU templates. So as you can see, there's the definitions section that really sets forward some defined terms such as the MCP TCM liaison. And this also provides the capitalized terms that are otherwise not defined in the specific MOU, but are defined in the new 2024 managed care contract. Also contains services that are covered by the MOU. So in this circumstance, it would be those TCM services. Sets forward parties' obligations and really describes each party's provisions of services and their oversight responsibilities. A training and education section, which requires the MCP to provide education materials to members and network providers about the covered services and other parties' services when available, and setting forward training responsibilities related to those services. There's also a referral section, which requires the parties to refer to each other as appropriate and describes each other's referral pathways. There's a care coordination section, which, as you've seen in the goals and the foundation of the MOU, that really describes the policies and procedures for coordinating care between the parties and addressing barriers to care coordination, and then really ensuring monitoring and improvement for the care coordination moving forward. We've also placed the quarterly meeting requirements, which requires the parties to meet quarterly to address care coordination and quality improvement activities to really, improve the coordination and collaboration across the entities. There also is a quality improvement section, which requires the parties to develop quality improvement activities specific for the oversight of the MOU requirements. In addition, some of the foundation of the MOU is really related to data sharing and confidentiality, which requires the MCPs to have policies and procedures for sharing the minimum data and information necessary to ensure that the MOU requirements can be met. So this really sets forward the minimum necessary information that needs to be shared to really support the care coordination and the goals of the MOUs. There's also a dispute resolution process section that includes the requirement to describe the policies and procedures for resolving disputes that may occur between the parties. We've included an equal treatment section that provides that nothing in the MOU is intended to benefit or prioritize Medi-Cal members over persons who may not be receiving services from the other party. And then we have like a general section that contains some of the contract requirements that are in the managed care contract, such as posting the MOU publicly once it's executed, the annual review requirements of the MOU, and notating that the MOU cannot be delegated. So we wanted to give a quick overview of some new policy that was released that was incorporated into the TCM MOU, which probably many of you have already seen, as it was the MOU was released for public comment and the comments are due back today. So DHCS will release an updated ECM policy guide in this month, we anticipate. And then the new version of the guide is going to contain some additional provisions. So DHCS maintains the guidance that was effective July 1st, 2024, that members cannot duly enroll in county TCM and ECM. The updated policy guide that will be released this month provides a time-limited exemption to TCM and ECM overlap, which really notates that beginning July 1st, 2024, members who meet ECM population of focus criteria should be enrolled in ECM and may no longer be enrolled in ECM county-based TCM programs at the same time, except for a one-year exemption from July 1st, 2024 to June 30th, 2025 for cases where the member is receiving county-based TCM for addressing communicable diseases for the sole purpose of receiving a home visiting program supporting the healthy development and well-being of children and families. Ultimately, the ECM provider must retain primary responsibility for overall coordination across physical and behavioral health delivery systems and social supports. And then, as notated, this is contained in the TCM MOU that was released for public comment. And then some other provisions that are really specific to the TCM MOU template includes a definition section, which really defines the LGA TCM program services, and then LGA TCM program obligations, which provides a focus on the services that are provided by the TCM program. And then there's also a specific section related to eligibility screening and referrals to LGA TCM program and the MCP, which really clarifies the responsibilities across the parties and developing policies and procedures to support the screening and referrals. In addition, we have the coordination and collaboration between the MCP, LGA, and TCM programs, which again requires policies and procedures to really outline coordinating members' access to care for services that are delivered in each of the delivery systems. So the MOU execution timeline for this, MOUs are required to be executed by January 1st, 2024 for this memorandum of understanding. We understand that, the MOUs might take some time to execute. So we have implemented a requirement that the managed care plans can submit quarterly reports demonstrating good faith effort for the MOUs that are not executed by that July 1st, 2024 date. And the managed care plans are aware of this process. So we will work collaboratively with them to receive that quarterly report, and we'll work on establishing those timelines. So we are going to pull down the slide deck and then open it up for questions with all of you. I will say that if you have any specific questions related to the TCM and ECM overlaps, I would encourage you to ask those early on, as we do have some subject matter experts that are here today that are only able to join us for the next 13 minutes or so. So if you have any of those questions, please prioritize those at the beginning of the call. Feel free to raise your hand and or drop your question in the chat. And then Alice, I'm going to request that you pull down the slide deck so that I can see people's faces and really have a collaborative discussion. And then Amy, I see your question about the due date for the quarterly report. We have not established when the targeted case management MOU quarterly report will be due. The MCPs were already required to submit their first quarterly report at the end of December. And we've received that for all of our managed care plans for the MOUs that have already been issued. And so that we'll have more information forthcoming. We are anticipating releasing this MOU template sooner than we've issued those other templates. So our hope is that the MCPs and TCM programs will have the MOUs executed by July 1st, 2024, but we understand that there may need to be an opportunity to communicate good faith effort. All righty. Could you please provide more information about the overlap of TCM and CHW services?
It looks like Amara froze just at the wrong moment. She did. I'm Laura Miller. I'm in primary care internal medicine doc in quality and population health management. I think I want to wait on that. I know that we have talked about those differences, but I'm not prepared to delineate perfectly. So I want to let that one be unless somebody from Manat or other DHCS folks are on the line and can support that. So I'm going to go on to the next question. There's Amara back. Are you stable and able to chat, Amara? I was trying to riff here. I was wondering, so I am not able to super accurately answer the TCM CHW question. So if you can take that one, that would be great. It's the overlap question.
Yes, thank you. And that is a great question. I think I'm going to need to circle back with you on.
Okay, Amara is intermittently freezing, but I did hear her say circle back, so that's great. So we will do that. The question from Melissa about does TCM have the same populations of focus? The ECM populations of focus are not the same as TCM. And I would describe it as a series of overlapping Venn diagrams. So other than those two TCM services, the communicable diseases and the home visiting for newborns, etc. Those are the two that are on a glide path and are allowed to have ECM and TCM for this year. But otherwise, they are different populations of focus. The next question, some MOUs are executed sooner than others. Is there a standard annual review due date, or does it go by execution date? Amara really is the subject matter expert on this one, so I'm going to have to defer that.
Thank you, Laura. I'm back. Thank you.
Okay.
I apologize. I'm having some technical difficulties, so I'm going to stay off camera in hopes that I can stay connected because I keep getting disconnected. So I apologize. Thank you for that question, Amy. I think we are going to need to circle back with you on that, as most of our focus has been on the MOUs that are executed July 1st or January 1st. It's a great question. We are going to need to take that back and then provide a response. I will notate that the execution dates are going to be different regardless of when we've required the MOUs to be executed. So I think we need to think through that a little bit more and provide some additional details to the plans. So thank you for that great question. And thanks, Laura, for filling in.
Trying.
It looks like we have another question. Isabella, on DHCS's TCM site, there is a link for a list of LGAs participating in the TCM program, but it only gives the TP by county. Where would we find a list of LGA names for the county? Is there a different from the TCM MOU at all? Do we have anyone that oversees the TCM program from DHCS? Do we have Uma on the call by chance that can maybe provide a little bit more information on the county list? It looks like Uma is
Hello,
available.
everybody.
Oh, thank you.
Yes, I'm on the call, but I'll have to circle back on that as well. So let me take this question back, and then we'll share the responses. Amara, I'll work with you on how we share the responses.
Sounds great. Thank you. We appreciate that feedback.
Definitely.
Alrighty, some really great questions. So thank you all. Do we have any more questions? Feel free to raise your hand and/or drop it in the chat. There's flexibility in the term of the MOU, and that's why it's contained in brackets. So really there needs to be a level of coordination between the parties on how long the term will be. We do have a requirement on the managed care plans to complete an annual review of the MOU.
Hey, Amara, I see a question from Sarah Grant about the cover page of the local health department MOU. I can speak to that. Attachment F just means it's an attachment to the APL that was released along with the MOUs, which contains the requirements and expectations on MCPs. So the MOU is a template to be utilized, but it's as it was published as an attachment to the APL. So that's why it says attachment F.
Thank you. Any other questions? Yes, we can drop the APL in the chat for you. It's 23-029. But I'll drop it in the chat as well. Oh, thank you, Sophie. Alrighty, any other questions? Are MCPs required to have liaisons with each LGA? Yes. that would be a requirement to ensure that there would be coordination, and really ensure that there's a point of contact to assist with resolving any concerns. So there would need to be a point of contact for each LGA. Now, whether it's a different point of contact or not, we really need to make sure that the needs can be met. So we understand that there may need to be some flexibility in that regard, but making sure that there can be appropriate coordination to resolve any concerns that are addressed would be important to take into consideration when assigning those liaisons. Great questions. Any other questions? Alrighty, we'll give it just a minute longer. When will the final MOU be released? So next steps for the MOU, great question. We are expecting all feedback in today. We will be reviewing the feedback, making appropriate edits to the MOU template, and then we'll be releasing it as final. So I would anticipate it being released as final in the first quarter of this year. We don't have a firm update at this time because it's really kind of dependent on the number of comments that we receive for this MOU, but we're looking forward to receiving the feedback and then determining what edits we will and won't be incorporating based on the feedback we've received. Right, any other questions? If not, I want to thank everybody for joining us today, and I want to thank our internal partners for joining and supporting the discussion. And we'll circle back on a few of the questions that we received that we didn't have answers on. And thank you so much for that. I see one more question. Will there be an opportunity for stakeholder feedback on included edits for the final MOU? There typically is not. We will work with some of the key associations to ensure and complete kind of a fatal flaw review before we do final edits, but we do not anticipate that we would release for an extensive stakeholder review process a second time, as we've already distributed that for stakeholder feedback. So if you have any feedback now, please feel free to submit it. Today is the last day to submit feedback. The deck should be attached to the invite. If you did not receive a copy of that, we'll be sure to make sure that you receive a copy. It'll also be published on our website, and the recording will also be available on our website. And thank you, Sophie, for attaching the deck.
I have a question though about the changes. Is it okay to ask?
Absolutely.
So you were saying that this is pretty much the final for public comment. If there's any changes that maybe weren't on the original, would that go back out for public comment, or will it just be what it is, whatever folks have provided as their comments or suggestions, they'll be taken into consideration or not, and then it is what it is? Or I guess what I'm saying is, if there's going to be some like extensive changes, will it go back out for public comment?
That's a great question. We don't anticipate extensive changes based on how we've done the process before. I also want to reiterate that the MOUs are really intended to cover and contain existing policy. So there would have been an opportunity to provide feedback on other policy that was implemented, and really it wouldn't be a large divergence from what we have already included if we would make edits. And if there was a large divergence, we would work with our association partners. We've been working very closely with SHIAC on this, and we would kind of work through that same process. So I do want to flag that we don't anticipate major changes to the template, and it's really just codifying existing policy. And if there are major changes from our current policy, we would be working with our association partners, but we don't anticipate it would go out for public comment again.
Thank you. I have another question regarding TCM and ECM. I know that there's there's an exception for 1 year for the overlap for those certain populations. is there going to be any further talk about that it being extended or making exceptions, or is that between the MCPs and the LHJs, or does that need to come from DHCS, if at all?
So I can speak to that a little bit. That was I would say an extended conversation to achieve that exception with CHIAC and DHCS. So I think that that is probably no more movement there is what we would expect. So the 1-year exception, and then that would close. I don't anticipate there being further opening up of that conversation. It was extensively discussed before the exception was concretized.
Thank you very much.
Thank you. And then I see a few more questions. Will the policy guide be released before or after the final MOU is issued? We anticipate that the policy guide would be published before that final MOU is issued. If you have any feedback to add to that, please feel free to come off chat if you want to have a conversation. It might be helpful to have a conversation if there's anything else that you want to add. If not a problem. And then I see another question. Are MCPs required to conduct the quarterly meetings prior to the execution of the TCM MOU? I will say, the expectation is that the MOU would be executed July 1st, 2024. We wouldn't anticipate that there would necessarily be quarterly meetings prior to that execution date, but really conversations between the two parties to determine, what provisions will or won't be contained in the MOU for, those optional provisions that I talked about a little bit more in detail. So there would need to be a level of coordination to execute the MOU, but as far as quarterly report meetings prior to July 1st, we would not anticipate that we would not make that a requirement. All right, any other questions?
I just had a follow-up question for Isabel, who raised a question about the target populations for TCM. So thank you for sharing the link. And I looked at the page, and on the left side of the page, it lists all the LGAs. So I'm wondering if you were referring to a list of MCPs by county. I just wanted to clarify your question.
Hi, Uma, it's Isabel. Thank you so much. No, I was trying to find out which local government agencies were participating. So are we on that site? It lists the county. So I represent Kern County. And so is it the local health department that's participating? Is it our county probation agency that's participating? That's what I'm inquiring about. I'm still learning about the whole TCM process and program. So any background would be helpful.
Thank you for clarifying. Yes, so it depends on the county. And for Kern County, we'll just have to go back and make sure we know which agency within the county we are participating. Sorry. Thank you, Sarah. So for Kern County, it's probation.
Thank you very much. That's what I figured, but I wanted to confirm. Thank you so much.
Perfect, thank you.
Great questions. Anything else? Great, thank you. Well, we look forward to receiving your feedback. I appreciate your patience as we work through some technical glitches today. Really want to thank everybody for joining. I appreciate the partnership that we've had with our internal divisions as well as our associations. It's been a collaborative effort, and we look forward to further collaboration. So thank you everybody for your participation today, and we look forward to receiving your comments.